we're going to have a real national debate. I don't believe you solve problems dealing with poverty under the liberal model that we've had for the last 40 or 50 years of people being helpless. Okay? Now, Marvin Olasky wrote a remarkable book called The Tragedy of American Compassion, which really helped define our welfare reform proposals in the 1990s. And I just want to suggest to you that we need to rethink Medicaid much the way we rethought the process of welfare reform. For example, Governor Jeb Bush, when he was governor of Florida, had a program where if you had diabetes or you had asthma and you took care of yourself, so you didn't need to go to the emergency room, you got a Christmas bonus because you had saved the state so much money by taking good care of yourself that it was profitable to actually reward you for being a mature, responsible person. Now, that notion of linking behavior to reward, which turned out to be very effective with poor people because, to the shock of academics, it turned out they were aware of money. But notice, we're now, I'll give you a classic example of how you save money in Medicaid rather. The number of people who walk into emergency rooms in order to get aspirin is an absurdity. If you simply had an ability to triage as they walked in, and if what they needed was an aspirin, they went to the equivalent of a minute clinic, and that cost, $30 or $40, and the hospital wasn't charging you an emergency room visit for giving them aspirin, you save an immense amount of money. But if secondarily you start tracking that person's visits, and they're clearly abusing the system, there should be a point where there's a consequence for abusing the system. We have, and this is going to be very controversial, we have to start distinguishing between the taxpayer as being concerned for charitable care and the taxpayer as being a sucker to be exploited. And that's a big difference in the current system.